Yeah, I remember in July of 2020, due to health reasons, I had a chance to go back to Taiwan for a duration of time. And at that time, there were mandatory quarantines in Taiwan. And I remember the whole quarantine process was very organized. From the moment that we landed, we know exactly what to do. Uh, where we were given electronic form to fill out, and we also had the testing done, which was very efficient. And we were also given uh, cell phone tracking cell phones for each member of us. And I remember arriving in our quarantined place with my family, and the whole process is actually quite humanistic. I remembered there were two police that came right away after we arrived to check us and make sure that we had everything that we needed. Give us a care package, which include uh, food and some goodies, even uh, waste bags for us to keep our waste, and then give us a mask.
What do you see in terms of the pandemic going forward in 2023?
Yeah, as a critical care doctor and pulmonologist, I remembered COVID initially. It was quite concerning and actually scary. That I remember seeing the first wave back in April 2020. The ICU was full, and we had very limited resource. I remember the days that we were asked to use N95 mask 5 days straight, uh, and um, at that time we have uh, very little experience dealing with the daily virus. And I remember uh, the patient dying. Usually, they would come in if they don't get better by day 3 or 4. Usually, they would pass on. And but since that time, for the past year, we have seen the uh, virus becoming less and less virulent, although more transmittable, but less virulent. And so I do think that COVID will become a virus, part of the viral pool that would cause common cold.
Dr. Chang, how do you feel the US approach differs from that of what Taiwan employed in the past 3 years?
Being a clinician in the front lines of dealing with the virus, I remember early on, our office of 13 physician had to scramble for basic materials such as mask, and and that's a big difference when in Taiwan, where my sister runs a clinic. Uh, they have allotment directly from the government, and a fairly uh, good guideline in terms of how to deal with the virus and pandemic. And I think there's much more governmental guidance in dealing with the pandemic from the Taiwanese government.
The government announced that on the 20th of February, masks will be no longer required in most cases, except for mass public transportation and facilities, medical facilities. As a critical care professional, Dr. Chang, how do you see this?
I think as the virus evolve, there is less concern about the viral infection. And in terms of mask wearing, we do know that it does help in terms of transmitting respiratory illnesses. And what it comes down to, it really is a personal choice. I think medically, if the individual have higher risk for contracting respiratory illnesses, I would still consider wearing masks. And I do think that the timing is reasonable to consider at this time, but I think it need to be individualized.